Infertility Options for Motherhood. Are you a woman and have been trying to have a baby but have been struggling? Are you 35 and up and have been trying to conceive for 6 months or longer? Irregular, absent, or painful periods? Underlying fertility problems? Diagnosed with endometriosis or pelvic inflammatory disease? Have experienced a miscarriage or undergone treatment or cancer? Or are you a male and have low sperm count or other underlying issues with sperm, testicular, prostate, or sexual problems, undergone treatment for testicular cancer, small testicles or swelling in the scrotum, or a history of testicular problems in the family? Well, we are here to help. Cryopreservation is the ability to freeze and thaw with retention of viability. It provides flexibility in human fertility therapy when gametes or embryos are handled in vitro. Frozen tissue can be stored indefinitely, and we use liquid nitrogen at about negative 196 degrees Celsius. And this provides assisted reproductive technology coupled with a backup option just in case the sample cannot be collected on demand or if sample quality is poor the day that the eggs are available. Why would you want to preserve your sperm? Well, sperm cryopreservation is relatively simple and rapid, does not necessarily involve seeding or the use of slow controlled rates of cooling, and after sample collection and liquefaction, a cryoprotectant is added to help protect that sperm. For embryos, it might be a better option than having extra embryos destroyed. It can also provide another chance to get pregnant just in case the in vitro fertilization process fails the first time. And embryos can also be used later to have a second baby if the first time around is successful. Embryos can also be saved if you were to begin treatment, for example, chemotherapy that might affect fertility. The embryos could be saved and donated to another person, or it could be saved and given to another family member. Now, the main concern is donor insemination safe? Well, in fact, it is very safe. Samples are quarantined for about 6 months before their use, and donors are screened for sexually transmitted diseases at the time of collection. This decreases the rate in which STDs and STIs can be transmitted through donor insemination. And frozen samples are released for 6 months later, only after the donor passes another round of rescreening. Sex selection is actually the process of a couple or individual choosing the genetic sex of their child by testing the embryos created through in vitro before it is implanted into the uterus. And the type of chromosomes inherited that determine sex of the baby are the X and Y chromosome. One comes from the father and one comes from the mother. And what we do is we test the cells of the fertilized egg, and we look at the chromosomal makeup. From there, we then only implant the embryo of the desired sex transferred into the uterus. A lot of people ask, what is a surrogate mother? Now, there are actually two different types of surrogate mothers. There are a traditional surrogate, where women who artificially inseminated with the father's sperm, they then carry the baby and deliver it for you, and you and your partner raise that baby. And a traditional surrogate is the baby's biological mother. So, a donor sperm can be used in the case that your partner's sperm is not viable. Now, there's gestational surrogates, and through in vitro fertilization, it is possible to gather eggs from the mother, fertilize them with sperm from the father, and place the embryo into the uterus of a gestational surrogate. This surrogate then carries the baby until birth, and they don't have any genetic ties to the child. So, if you have been trying to have a baby and it has not been working out, don't give up. Though the path to motherhood is hard, it is well worth it, and we are here to help you through every step of the process. Give us a call today. The presented information in this ad has been gathered from the National Institutes of Health, the Mayo Clinic, and various scholarly publications.